of this country during this difficult period. And many persons will suggest that Trinidad and Tobago is not a real place. But thank God we have real leadership and, of course, real people tackling real issues. And we are in a position now where we can safely say we are wiggling our way out of this crisis. And of course, here in Tobago, we look forward to the continued collaboration with the central government as we continue to lead this island and this country by extension in such a way that we will prevail even in these difficult circumstances. Thank you.
Thank you very much, Chief Secretary Ansel Dennis, for your kind words. And I, at this point, would like to turn the floor over to the Secretary for Health in Tobago, Councillor Tracy Davison Celestin, who will tell us about her responsibility here in Tobago as part of the national effort in facing up to our COVID challenges.
Thank you very much, Dr. the Honorable Keith Christopher Rowley, Prime Minister of Trinidad and Tobago. I wish to provide the Tobago public as well as Trinidad and Tobago with an update on what has been happening here in Tobago as it relates to our work from the Division of Health, Wellness and Family Development. And to let you, the members of the public, know that even as we prepare for the reopening of our country and our island, we continue to prepare to respond to COVID-19 here. And so our policy staff, our clinical and social services staff have all been working very hard. They have been working assiduously to mitigate the impact of the pandemic, to mitigate the impact of COVID-19 as we prepare our island for a second wave. And we have all been looking at the lessons that we have learned from our first wave to ramp up, of course, our services and our readiness for future epidemics. And we are determined to make this not our darkest hour, but of course our defining moment. And so with that in mind, the pandemic has re-energized all of us, and it has become a launchpad from which we can expand, from which we can ensure a sustainable development. The Division of Health, Wellness and Family Development, in accordance with the national and international guidelines, we have been collaborating with the Tobago Regional Health Authority to ensure that quite a number of measures are in place. And over the last month or so, we have been communicating those measures on a very regular basis so that the members of the public can have information. We have been looking at how public health and our social measures, which including the lockdown measures, were adhered to. We have been providing the necessary education to our people out there, ensuring that you follow with regards to those rules and regulations that were set. Apart from that, we have been focused on surveillance. Surveillance meaning that we have been keeping a close eye on any potential or suspected cases here. We have also been focused on containment measures, which has to do with isolation, quarantine, and even contact tracing. And our public health staff have been leading in that regard. We have been focused on case management, that is the treatment of persons affected, and of course our risk communication and community engagement. We have ramped that up over the last 2 weeks, of course encouraging persons to come out and be tested, and we have used quite a number of different methods and modes of communication in order to get that message across to you, the members of the public. What have we been doing very recently? We have been refurbishing some of our facilities. I would have communicated that we have our facilities up at where the old hospital was located, or Trek facility, the old Scarborough Hospital, as well as a geriatric facility. We have been getting those ready to receive any patients, whether they are well or not well, in the event that we are to have an increase in numbers when the borders reopen. Because as I said, we are preparing for the second wave of the virus, and when you look the world over, you would see that the cases have been increasing. Those cases have been rising. We have also been focused on increasing access to hospital services, because we are not only focused on treating with COVID, but we have been focused on providing health care to our clients out there. And so we are working endlessly on returning the Scarborough General Hospital and reverting to utilizing the medical ward at the Scarborough Hospital. And so that we are going a process of sanitization at this point, and we are looking to return to providing major services, major surgeries, and currently we are providing minor elective services, surgeries at the hospital rather. Within this fiscal year, we will be procuring and constructing a field hospital, and so that will help us in the event that we have to treat with any future pandemics, in the event that we have to treat with any infectious diseases going forward. We have secured quarantine facilities, as I would have indicated to you, and with 4 flights per day from Trinidad, our specialist outpatient clinics have certainly restarted. In our primary care clinics, we have maintained service levels and access. Over 11,000 patients have been seen, which is just under 10% of clinic attendance for the same period last year. And I've been advised by Dr. Mitchell, who is sitting here with us, that over 718 home visits have been conducted to date, and those were home visits to persons who were unable or too immune compromised to come to our primary care facilities. I also want to report that for the first time in Tobago history, Tobago has its own PCR machine. We had some challenges initially with obtaining the test kits. Those test kits have since been received. I think they would have arrived in Tobago on Tuesday or Wednesday, if I'm not mistaken. And we are in the process now of validating the machine so that we can provide testing here for infectious diseases. And we're not only talking about testing for COVID, but we're talking about testing for any viral diseases, infectious diseases, HIV, AIDS, so to speak. And the team at the hospital, as well as our public health staff, have been working assiduously to have this finalized within short order, and it is expected that within a period of 45 minutes we can have results for us to make rapid decisions. Last but by no means least, we had some challenges during the course of the week with the brazen pan at the hospital. That has been fixed. Catering is back to normal, and they have been practicing health and safety standards, and our surveillance testing continues. Luckily, we have no new cases to date, and we are glad that that would not cause a delay in the reopening of the island. And then we have our family development services. They have been ramping up access in terms of providing social support in our communities, providing assistance through the rental assistance grant programs, providing vouchers, providing food cards. And we have been very determined to meet each and every one out there in the communities so that we can provide that level of care and so that we can provide that level of support going forward.
Thank you very much, Secretary for Health, Councillor Tracy Davison-Celestin. And coming to you from the I.A.N. Mitchell Gift Auditorium at the Scarborough Library, Tobago, it is my pleasure to introduce another visitor, the Minister of Health, Mr. Terence Dayal Singh, to give us, the Minister will take us on his normal little short tour and give us the national report on Trinidad and Tobago's numbers with respect to COVID. And Minister, you would lead on the 2 doctors. And I should say, we do have here with us Dr. Roxanne Mitchell for any question that may be specific to the Tobago issues as alluded to by Councillor Tracy Davison-Celestin. So we hold that for question time. So we have our Chief Medical Officer and Dr. Roxanne Mitchell. and they will come in at question time after the Minister.
Thank you. Thank you very much, Prime Minister. What the Prime Minister did not say, while he said I was a visitor, I'm a frequent visitor. Frequent. Thank you, Prime Minister. Chief Secretary, Ansel Dennis, pleasure to meet you in person. Same thing to Secretary of Health, Wellness and Family Development, Tracy Celestin. We have a very close WhatsApp and telephone conversation, but now we see each other in person. Yes. Ladies and gentlemen of the media, the national viewing and listening public, it is also nice to see Elizabeth Williams in person. I only see her on a screen and on TV. So, my report before I hand over to the Chief Medical Officer. I'm very pleased to be here today. The TRHA, the THA, and TEMA has been an integral part of this national response. It's a national response. And this integration has ensured that both islands responded in a world-class manner, absolutely world-class manner. And what the Secretary spoke about also applies in Trinidad because we had a parallel healthcare system going. And that is that normal healthcare delivery was never stopped. That is a massive achievement because many hospitals around the world were crushed under the weight of COVID and normal hospital services could not happen. Babies couldn't be delivered, operations could not go on, and people died. In one country, someone died because the ambulance couldn't get access to a hospital after going to 8 hospitals. We were spared that because Trinidad and Tobago instituted this parallel healthcare delivery service. So at these press conferences, I normally give a bit of the global figure. And ladies and gentlemen, it is important to realize that the world recorded its highest one-day record of coronavirus cases just yesterday or day before. This is far from over. The highest one-day record was recorded in the past 48 hours, a full 5 to 6 months into this phase of the pandemic. Globally, there are 8,847,560 cases. I am sure by the time I hit the Trinidad press conference on Monday, we will be talking about 10 million cases, or pretty close to it. 464,590 persons have died. And 54,501 persons are in very serious condition around the world. Serious condition means they are in a tertiary hospital setting, on a ventilator, in a high dependency unit, in an intensive care unit. So those are the highlights of what is going on. Before I come to my short tour, I want to refer to 2 issues that I raised at Wednesday's press conference in Trinidad. And that is the issue in New Zealand, where 2 persons who were let go from quarantine for compassionate reasons spawned 320 contacts. The brief I got in the morning said cases. Let me clarify, it's contacts, and they are now trying to distinguish whether those contacts fall under probable and possible cases. But it's a bit of a problem. And that is why we have to be so careful with our quarantine facilities and not allowing people to leave quarantine before time or allowing them to have visitors into the quarantine facilities. I also raised the issue on Wednesday about Beijing, China, which recorded 137 cases. You may remember that. The news coming out of China now that they have what is called sequenced the genetic material, sequenced the genome, is that that is now seen to be a European strain of the coronavirus, not the original strain. Next week, Monday and Wednesday in Trinidad, will have Dr. Erica Wheeler from PAHO and Professor Christine Carrington from UWI tell the national population what does that mean. What does it mean now that the European strain has been introduced into China? What is the level of concern that we should have in Trinidad and Tobago? And what are the implications for how countries manage their borders moving forward? So that's my very brief report for this morning, and I want to thank you very much for the warm welcome I have received in Tobago. Thank you.
Thank you, Minister. Could we ask Dr. Parasram to give us now his numbers for Trinidad and Tobago situation and our progress as we face this challenge?
Okay. Good afternoon. Honorable Prime Minister, Chief Secretary, Tobago House of Assembly, Honorable Minister of Health, Secretary for Health, Dr. Mitchell, members of the media, members of the viewing and listening public. The clinical update for June 20th, 2020 is as follows. The number of samples submitted to the Caribbean Public Health Agency, as well as the UE site for testing, stands at 4,286. Number of unique patient tests completed thus far, 3,732. Number of repeated tests, 554. Number of samples which have tested positive remain at 123. Remembering the last 7 cases we would have been imported. Number of deaths remain at 8. Number of persons discharged thus far at 109. Of the last 6 cases, we would have received their first negative already. So hopefully we'll have those 6 persons being discharged in short time. With regards to the parallel health system, we are now housing a total of 608 persons in quarantine. The remaining persons, taking it up to 615, are being managed throughout the system. So with regards to the UE daybase site, there are 50 individuals housed there. In the Chancellor Hotel, there are 22 persons. At the Napa site, where we house healthcare workers, there are 12 individuals. At the Home of Football, there are 8 persons. At the Sandy Grande facility, there are 24. The UE Canada Hall, we have 99 individuals, which were repatriated students from Jamaica. In the UE Freedom Hall, there are 46 individuals repatriated from Barbados, students as well. In the Cape Park Hotel, there are 48 persons. And as you know, on the Enchantment of the Seas, the vessel offshore, there are 295 persons. So, Prime Minister, that's my short update for today.
Thank you very much, Dr. Parasram, for those numbers. Ladies and gentlemen, it is easy for us in Trinidad and Tobago to begin to be blasé about an experience which some of us might think we had. I would rather say an experience we are having. Because whether we are alert and aware, cooperating or objecting, the fact is that we, like every other country in the world, we are responding to a pandemic which has killed and is killing lots of people around the world, which has disrupted every economy in the world, which has created huge financial losses, which has brought pain and suffering to tens of thousands of families, and which has changed the way the world is and will do business going forward. So there's no case to be made that this is a breeze that has blown and we are back to a calm that we've always known. When I met you last time, or before we started to reopen our economy with the tentative steps we took in phase 1, we introduced to you a 6-phase possibility and indicated that we will, numbers permitting, open our economy in steps to make sure that as we do so, what we evaded in the beginning, we don't invite in the end. We are still doing that. We are opening up our economy. The numbers have been good to us. The numbers that Dr. Parasram has given to us today are very much saying to us the same thing it was saying to us in phase 1, phase 2. Basically is that we in Trinidad and Tobago, unlike very many places in the world, we do not have a severe infestation. We are not seeing new confirmations, but we are exposed to the rigors of this virus. It is the actions that we have taken, that we are taking, and that we will continue to take that will preserve that story for all the people of Trinidad and Tobago. Unfortunately, in doing this, some people are affected more than others. But I did say at the very first occasion I addressed the nation on this matter, that the actions that we are going to be required to take and that we will take, there will be negative consequences. There will be burdens to be carried, and those burdens will be shared. But as a people, as a country, as a government, we will do everything possible to make sure that there's sharing of such burdens and that there's protection of all. It remains an assignment of saving lives. And then it becomes an assignment of saving our economy and saving our country. So today, I want to confirm what I said last time, that I'd meet you on the 20th, and we look towards what we are going to do on the 22nd, which is next Monday, numbers permitting. I can tell you the numbers are permitting. So we will continue to open up our economy and our country as follows. Way back in phase one, you remember we shut down restaurants and we did not allow restaurants to operate. Then a bit later on, we allowed them to operate, but no in-house dining and so on. Today, all establishments are restricted to the following hours daily, closing at 10 p.m. And those are restaurants, which will be allowed in-house dining, and bars would be allowed to be open. Cinemas and theaters, casinos and members clubs can open and operate their business. Later on in this program, Dr. Parashram will speak to you on the specific conditions that are going to be required. So as we open back for business, we are maintaining certain conditions for that opening. But suffice it to say at this minute that such businesses are to reopen. But reopening, in the context of what I said before, that we are still exposed to infections in a pandemic, and therefore, while we are open, we'll be required to do certain things. There will be a full reopening of all malls, including food courts within the malls. So the malls come back to normal business, more or less. Again, subject to the conditions that Dr. Parashram had mentioned a bit later on. I am listening for the loud cheer to this one, that beaches and rivers will be open from Monday. Amusement parks and the zoos will be open. And of course, anxiously awaited, team sports can begin, gyms will be opened, but where team sports are allowed, there's to be no congregation within venues. For example, you won't have spectators at the venue organized for the event, but the players can play. And of course, the gyms would be open in the context of what Dr. Parashram would say later on as to how close you get. Educational institutions will be allowed to reopen for the purposes of examinations and all other preparatory work. In short, everything to do with education except children going out or students going out and being tutored at the venue. But everything else would be allowed to be done, like who is going in to prepare for exams, to do whatever you do. The only thing that is forbidden is students coming back out at this particular time. The full reopening of schools and educational institutions, preschools and daycare will remain. The preschool and so daycare centers will remain closed until September, and this particular issue will be under the guidance and further commentary from the Ministry of Education. But as of today, those preschools, daycare centers would remain, and the horizon we're looking at for them is September. Also, the last time we spoke, we did take steps to bring the public service back into operation to service the public. The last time we spoke about a 50%, coming back to today, I can tell you, we expect, it is now authorized that from Monday, the full public service functionality would be expected to be out. The public service comes back out to work. with optimization of flexi time, work from home, virtual meetings, and these facets of the public service would fall under the direct control and management of permanent secretaries, who would fall under the control and guidance of the permanent secretary to the Prime Minister, who is head of the public service, who will determine how these operations are done. But let it be said from today, come Monday, if you are a public servant, you are expected to be back out to work when I don't want to use the word normal, back out to work under the new conditions that are going to be out there. Also, public transport, including the inter-island transport, will return to full service. The regulations as it relates to congregation in a public space will now move from 10 persons to 25 persons. So you see, one time we were 5, then you went to 10. Today we are saying the groups that you can have is 25 persons. And Dr. Parason will tell you, even if as we allow that, 25 persons, not one on top of the other. Social distancing is required in that group of 25. The regulations, events such as funerals, weddings, christenings, or any such religious events will now be permitted without restraint, except that they must follow the guidelines that we have given for the places of worship, which are already in use. Meaning, we're putting no number as to how many persons can come to a funeral or a wedding. But in the church, doesn't matter how many of you are in there, maintain the alternate rows and the 6 feet distance. So for any event, the numbers would be determined by that. We would have to mention again for the nth time, in all these situations, we expect you now more than ever to keep the hand washing going. Keep the hand sanitization out front, paramount, regular. Have clean hands at all times. So we're saying to you today, you might be touching your face once in a while, but touch faces only with clean hands. If you are not absolutely sure that your hands are clean, keep it far from your face. Try to keep your hands clean at all times. We currently are experiencing a decline in other infections other than COVID-19. And the reason for that is that in response to COVID, these protocols have made us a more hygienic people. And it has reflected itself in fewer of us reporting to the health facilities or even at home with flu-like infections. So keep the hand washing and the face touching in the way we have been. Most importantly is that social distancing. Most importantly, let it be second nature. Someone steps too close to you, step a little away without even making a fuss. Be alert. Because what we are doing to maintain our condition in Trinidad and Tobago, we are assuming that there is the virus among us, and therefore we are not giving the virus the opportunity to jump from one person to another. That is what we have done very well so far. The shutdown, the social distancing, the stay at home, and all of that. It is that observance of the protocols as directed to us. That is what caused us to be where we are today. The wearing of masks, where applicable, please, if you're going out, have a mask, wear it, because it is serving a very useful purpose. And of course, we are still asking businesses that are attracting the public, no mask, no service. And we expect to see more and more persons wearing masks, because what we have done here is virtually put everybody outside. And the more masks we wear, the better for all of us. The cough etiquette, I'm sure you know what that is. And if you are ill, with any kind of infection like a flu-like infection, please stay at home. It's not an excuse to not turn up for work. It's if you are ill, do the rest of us a favor and not come out. What used to happen before is that a person will come out with the flu because you're fighting the flu. You weren't particularly afraid of the flu. It will go after a week or two. But during that week, you may very well have infected a few people. So, with the case of COVID, because of its outcome, we don't want to risk infecting anybody. So if you come down with an infection, you're allowed to stay at home. And of course, you will communicate with your local health service providers, and then if you need to be tested, you will be, and they will monitor you from there. We had some requests early on. We were hoping that we would have been in a position to grant permission for the Labor Day horse racing event, but we couldn't. But today I can say to the horse racing fraternity, go back to your business. Horse racing is allowed. So all those who are associated with the horse racing industry, your business is open, but again, we want to maintain, as you do that, remember the basic principles of social distancing and cleanliness and so on. So horse racing is going back on. I don't know when the next event is going to be, but you can get back to your business. So those are the main changes that we have made. And what does that mean? It means that there are two areas of our country and our economy, our activity, which remain under wraps. One is our children, our school children, and the school system. And we have a horizon. We have exams, in CXC exams, which you know about already. We have the SCA exam coming up in August, which we're going to prepare for. And I trust that all of us would have calmed down by now and get ready to put the children through that. And most importantly, the one area that remains outstanding is the key area. The borders remain closed. That is what has kept us where we are. The borders of Trinidad and Tobago remain closed, and we will keep them closed as long as there is a health requirement. This morning, very early, in fact, as I woke up this morning and I turned on the television, the first person I saw this morning on television was the Director General of the WHO. And he was saying something which I find to be still quite disturbing. He was saying to the world from his office at the World Health Organization, today the 20th of June, he was saying to the world that the world is in a very dangerous place now with respect to COVID-19. And I want the people of Trinidad and Tobago to take that advice coming from that office, that the world of which we are a part is now a very dangerous place. And if you don't believe him, just look south of us and see the ravages in South America, which for quite a while in the early part of the COVID experience, South America was coming across as one of the clean and quiet areas. Today, 6 months later, South America, Brazil and its neighbors, with huge spread into the neighboring countries, as close to us as Suriname, are under the gun. We have 7 miles across from us is Venezuela. Venezuela has direct contact and very porous borders with its southern neighbors. Suriname, northern Brazil. And this morning, the concern is about the runaway numbers in Chile and into Peru. So please, people of Trinidad and Tobago, do not for 1 minute listen to persons with temporary and personal agendas and believe that God is a Trinity. Yes, God is a Trinity. That's why we have got this result, because we behaved like people of God. If we misbehave, we're going to join those people who are experiencing what I'm reporting here now. And when the head of the WHO says to the world that the world is in a dangerous place, let those with ears hear. And we as a people intend to hear. We want to keep our borders where it is, because outside of us, the pandemic is raging. The closure of the borders is not meant to penalize anybody. It's not meant to lock us in here and make us prisoners. It's meant to keep the virus out. And the virus travels by way of people. It's a person-to-person contact. It's normal common sense. If we in here deem ourselves not to be infected, but out there it is raging, those on the outside are the ones that pose a threat to us. I can tell you, we did say from the very beginning that we would be granting exemptions for persons to come in. We didn't say that we're going to cave in under the pressure and threat of lawsuit and beating down the door of the Minister of National Security and accusing the government of racism and accusing the government of discrimination. We didn't say that. We say in a sane and sober and civilized way, we would grant exemptions and bring some people in as we could manage, and we have been managing that well. We have managed to bring home a large number of our children who are abroad. They are now home in a matter of 10 to 12 days. God willing, they'll all be out of quarantine. We brought a number of persons home, many of them with very personal challenges. I can tell you as Prime Minister, in daily and probably hourly contact with the Minister of National Security and my colleague, the Minister of Health, we have a lot of citizens who are outside who would love to come home. And the one reason why they love to come home now is because of where we are now. If we mishandle the importation of people and we get a huge infection level, I guarantee you many of those persons may not be so keen to come home. We are giving priority to persons who are regularly domiciled in Trinidad and Tobago and who would have gone out for temporary reasons, either to work or for medical attention or whatever. Those temporaries we are bringing back home. We're not bringing back people who just suddenly decide that Trinidad and Tobago is the place to be and I want to go there because I have a passport. They are not the number one priority. We are bringing home those for whom Trinidad and Tobago is their normal, regular home, and then especially those who have special reasons to come home. And as we do that, we have to keep our eye not by how many people outside, but how much the health system can manage. That is the key. We can bring everybody home in one day if the airline can do that for us. And then it overwhelms the health system and everything we have done before would come to naught. On the other hand, if we bring them home in the way that we're going, it's not as fast as we would like because we have to keep our eye on the ability of our health system to manage any potential explosion. Some persons look at the number of rooms we have in the health system. It's not a straight case of arithmetic where the number of rooms mean number of people. The rooms are in different categories. We have to keep the hospital rooms empty even though we have no sick ones. Because in the event that there are sick people, where do they go? To the hospital. And then we can't put people on quarantine who have displayed no symptoms into an environment of the hospital. The hospital is not a quarantine place, it's for treatment. And then the quarantine places also have different categories. Persons who are yet to display symptoms and may not. Persons who have displayed symptoms and were mixed with people who have not. So the rooms, the service that's available in the parallel healthcare system are different categories for different categories of people. That is what makes the system work. So we'll be doing that. And also you will be hearing that some of our neighbors are opening their borders because they believe that it's okay for them to open their borders to international travel. While we are part of the CARICOM system and would love to do everything with CARICOM, in this matter of our health, there are some decisions that are going to be CARICOM and there are decisions that are going to be Trinidad and Tobago because we are not in the same position across the CARICOM. Different people have different things to do. We are constantly in contact with CARICOM. As a matter of fact, in the last few weeks, I have sat into 3 or 4 heads of government meetings because what COVID has done, it has allowed heads of government of CARICOM to meet frequently. Before, to have a heads of government meeting, you had to get dressed up, go to the airport, travel overnight, spend 2 days. Now we simply call for a meeting and sit wherever you are. I've had 2 of those meetings here in Tobago, right? And they tend to last even longer than when you are abroad. So we've been meeting, we're talking all the time. We have constant contact between Jamaica. I'm in contact with my colleagues in Jamaica, in Barbados, in St. Lucia. We're all talking all the time and trying to make decisions. And the big decision that we have to make is what do we do with our borders and how and when we can begin to introduce airline travel. As a matter of fact, I can tell you, those countries that have big airlines that service us all the time, a lot of pressure on our CARICOM neighbors now to open their borders to those transport under the understanding that if they don't do it now, they won't be able to do it for another 6 months and they would miss the winter season. So you better get on board now. That's the kind of pressure that my colleagues are under. And I don't know that that is the best way to be having to deal with it. But the airlines are making that offer. If you want to get in on the winter transport, if things get better, you may find that you have no transport if your system gets better. So if you want to get in on the winter transport, book now and get involved now with the open borders. But small countries are always under pressure, as you all know. We are a small country in this world. And at the end of the day, there's nobody looking out for us, especially when we don't look out for ourselves. So at this point, I would open the floor to questions, and we have the doctors, we have the Minister of Health, we have the Secretary for Health, and we also have Chief Secretary Ansel Dennis here. I'm sure Liz will have a few questions for Chief Secretary. Liz, this is a COVID conference with a little bit of national issues. I know you come with a notebook of... Good. So let's start with Whitfield. And that is not nepotism, eh?
Good afternoon to everyone. Thank you very much for the opportunity. I'll start with Madam Secretary Davidson Celestine. There are reports about with respect to port health workers, many of them would have retired or close to retiring. And given the situation now with COVID, they are even more important than we normally would think of them as. So the question is, there were also recommendations as to filling those vacancies, but that has not yet taken place. Can you shed some light on that in terms of what is going on, what's the kickback, and how soon those vacancies can be filled?
Thank you very much for the question, but the report has not come to me yet. And so now that you have brought it up, I will have a discussion with the administrator in the division to see exactly what is happening with regards to port health workers.
Okay. And with respect to the Tobago hotline, I don't know if yourself or maybe Dr. Mitchell might be able to see how the hotline is working now in terms of numbers. Have we seen a drop in the number of calls, those sort of things?
Thank you, Mr. Turner. With regard to the COVID-19 hotline that was established in March, on March 27th, we have to date received 118 calls, 116 of which were directly related to possible suspect cases, and the remainder of the numbers with regard to information only. The last call received on the hotline would have been on May 23rd, and we have not received any other calls on the hotline thus.
Okay. Back to you, Madam Secretary. The ongoing issue with the incinerator at the hospital, where are we right now with that?
With regard to the incinerator at the Scarborough General Hospital, we stopped incineration about a month ago. We are doing incineration only at the Scarborough Regional Hospital, which would be the old facility. We are also in the process of transferring the incinerator from the new facility back to the old facility. With regard to the air testing, we are still conducting our review with regard to that. Once the reports are back, we will then host the necessary meetings with the community. We have investigated those persons who would have complained, who would have had complaints, medical complaints, They were down to 4 households. They have since been examined and have been treated accordingly.
So just for clarity, is it that there will be no more incinerating?
We are not incinerating at present, sir, and we are moving that incinerator down, and we are looking at commissioning the microwave incinerator at the new facility, which does not have any emissions.
Okay. With respect to the COVID positive patients going forward, if we should have any, are we still looking at sending them down to Trinidad, or will we be taking care of them in Tobago?
All right, over the past few weeks, we have attempted to move the management of cases away from the hospital setting and also to prevent the transfer of persons to Trinidad unless it's absolutely necessary. And in that regard, we have operationalized the TREC unit, which is up at the old hospital, the Scarborough Regional Hospital, the facility that was once the old psychiatry area. We have 7 beds for immediate occupation if necessary, and we are currently constructing or reconstructing the geriatric unit to accommodate another 9 or so beds.
Okay. So in light of that, is there any plans to deal with the rehabilitation of persons since that space is now being used for a different purpose?
Rehabilitation, can you explain, please?
The old psyche ward that was converted to a rehab center, and it's now being used for COVID.
Right. We are in the process of finding a new location for them as well, yes.
Okay. PM, I think these questions might be for you.
These questions? You've had a ball. I'll have one question and we'll come back to you later, right? So have one question to me and then the other members of the media would have, and then we'll come back to your other questions. Right?
Okay. Now that everyone is going back to work, in offices where the numbers are such that physical distancing would not be permitted, what is the advice for such situations?
That is why I said that there would be the whole question. Earlier on we did say that some people can rotate. If that develops as a serious issue, permanent secretaries will be required to make the necessary decision so that the workers can allow the protocols to be observed. And those permanent secretaries would be guided under the head of the public service where those decisions are to be made. So if we do have situations where the physical distancing cannot be obtained for whatever reason or any other observation, and you require adjustments, then at the level of the permanent secretary and the head of the public service, they are free to make decisions to ensure that there's compliance. But this is not an avenue for skedaddling.
Good afternoon, Gail Thomas, Radio Tambourine. This question is for Dr. Rowley or the Chief Medical Officer. Dr. Rowley, you said that...
Wait. The same question can be for me and the Chief Medical Officer. My doctor is a geologist, right? So anything to do with pain and suffering, the Dr. Parasram will deal with that.
Okay, it's for Dr. Parasram.
Right.
Right, because Dr. Rowley said that beaches and rivers would reopen, yes? So could you give guidelines as to how many persons are allowed at the beach and other rules?
Sure. So let me just start with what we have in terms of guidelines. So I think I omitted the community testing, and people have been asking. So in terms of total community testing, there are 1,721 tests done so far. In Tobago, there are 190. With regards to guidelines published, and they're available on the Ministry of Health's website, we have the following: restaurants and bars, gyms, guidelines for places of worship, as you know, guidelines for business places, large and small. We also have guidelines published as it relates to cinemas and theaters, as well as we have had interaction with casinos and private members club in terms of having reviewed their guideline and found it to be sufficient. With regards to beaches and rivers, it is a particular, Prime Minister had spoken about the number 25. So we expect that any congregation will stick to 25 in a public space, which includes beaches and rivers. However, we want to, it can't be underscored, the new normal needs to continue, right? We can't expect someone to be having a bath in the sea and wearing a mask. So we have our new normal, right? So we have to use different parts of the public health measures in different ways so that we are able to satisfy the general principle, which is not getting infected with COVID or any other viral illness. So just to repeat, hand washing and/or sanitization, wearing a mask where appropriate. We don't expect, as I said, people to be wearing a mask while you're having a bath in the sea or having food in a restaurant. So that's why we have particular restaurant and bar guidelines. So when you have a mask off when you're seated, you're supposed to have other public health measures in place. So we're looking at appropriate cough etiquette, sanitizing frequent surfaces. This is particularly relevant to when you look at the guidelines for gymnasiums, etc., using weights and all the people go between those areas. Sanitizing becomes very important. Don't touch your hands if your hand is not clean, and it goes for your children as well. So don't touch your children's faces as well if your hand is not clean. So your hand has to be clean before you touch anyone's face. Social distancing where appropriate, and again we stick with the 25. And the most important of the lot, and I think Prime Minister touched on it already, which is staying at home if you're ill. I think most of the outbreaks we would have had in the world for infectious diseases would have been going back to the premise of people not staying at home when you're ill. I think the most important of the 7 guidelines that we have is staying at home when you're ill. If you have a family member that has a viral illness and you have mild symptoms, you have a sore throat one morning, you expect that you will have the virus, and you will expect that you will be able to transmit the virus. So we take the necessary precautionary measures, stay away from any mass gatherings to prevent spread as we have seen in other countries. Okay?
Let me just say something here before you go to the next question, because I'm sure, since I spoke, there are people organizing parties and party boat rides. Those are still under restriction. Party boats and parties, because you are not, by its very nature, going to be able to conform to the protocols that are still required, those activities are still not permitted. Because you can't be expected to be on a party boat and observe the social distancing that is required, or in a club having a party and people in your face and you don't, dancing and sweating and so on. So those 2 activities still remain on restriction. Partying in crowds and party boats in particular are still under restriction. In the very, maybe in a week or 2, we look at it again and see, once the numbers continue to be kind to us, we just keep opening up. But right now, just remember, those 2 areas are still on lockdown. Yes, you had another question. Oh, that was one. See, I tell you, it was one question for Doc. Can't be the same question for both of us.
Okay, so I have a book of questions, but I'll ask a few. Elizabeth Williams, TV6 News. Good day to everyone. One of my first questions is with respect to religious institutions. I don't know if you can clarify it, Mr. Prime Minister. In terms of the conducting of their affairs, is it that it can be longer than 1 hour, as you stated before?
They can go back to normal, but they must maintain the spacings that we ask for, which is alternate rows, and the congregation members should be 6 feet apart, and they can pray a little longer than they were praying. Initially, we had said 1 hour. Now we said, go back to your normal service, but whoever is in that service is required to be 6 feet away from the next person, and you need to have spacing by alternate rows. So a large place will have a much larger number of people in a normal service. A small church will have a smaller number, because what is key is not now the length of time of the service. We are making it key, the exposure to the person next to you, so that the social distancing is the key.
Okay. Some people are asking, I know you would have stated that the public service is back to work in full from Monday, but some are asking, what about daycares? Because parents are going out, where are they keeping their children? Daycares and also preschoolers, because we know that in terms of registration of these children, and I know you said all institutions back to normal in September, so how will the registration process?
Well, we think that a certain level of ingenuity and cooperation is required and would be, because when you bear in mind that preschools and daycares may not have been available in the period between July and September anyway. And some arrangements were made there. We do know that some people would be inconvenienced, but what we are asking that appropriate arrangements be made, and we expect that at the level of the public service management, genuine cases can be accommodated. Right? And that's what we anticipate. But what I want to emphasize here, these conditions that we are laying down for those people of this country who are responsible are serious conditions. And management of the public service must take a dim view of persons who attempt to use these operations for general skylarking and not turning up to work. If there's a genuine reason, it must be known to your managers, and then they would assist or cooperate with you. We put everything in place, that flexi time, alternate days if they're available and if it's thought to be useful, and whatever the permanent secretaries think might be useful in the short term, we allow those things. But just saying that I'm not going to cooperate and therefore get an extra free week, that is going to be frowned on.
Okay, and what about, and as you said that, what about holiday camps? You know, the July-August vacation.
For children, I think, Doc, answer that for me, please. I think the answer is that we're not encouraging that just yet. It's like a school.
So I think it falls into the category where we speak about all children in general, so that category deals with children. The exception, as we said, is for persons sitting examinations before September. Those are the exceptions to the rule.
And the reason being that it's almost impossible to keep children observing the social distancing. By their very nature, children are gregarious. When they congregate, they touch one another, they hug one another, they laugh into one another's faces. So we don't want to have that part at this time and have some of the children infected. Let's try and go a little longer and protect the children a bit more.
Okay, I will just ask, because I told you I have a whole page of questions, but I will just ask two more questions before I have my seat. And one of them is supermarket owners are asking, is it that 6 p.m. or can they go back to normal also in terms of closing hours?
The closing hours we're using now is 10 p.m. for business. So what used to be 6 p.m. we had brought to 8 p.m., right? Supermarket were at 6 p.m. and so I guess they normally close at 8, so they can go to the 8 o'clock closure. And of course, the cinemas and casinos and so, they will go to it at 10 p.m.
Okay, one of my final questions before I get to return again is directed to you, Mr. Prime Minister. Are you disappointed in terms of the grants issue? Are you disappointed? Because I know a number of Tobagonians are complaining that they are still yet to get these grants. Some have been evicted. Where is my salary grant? And also, Mr. Prime Minister, I think you should know, someone would have contacted me and would have informed me that in terms of small business owners, they would have applied and went into an office in Tobago and were told that they will have to go to Trinidad to receive their check. What is your view on this?
I couldn't answer to specifics, but what I can tell you, I was in Tobago a couple of weeks ago and I went to Channel 5 and I was confronted with the same issue with the host telling me that nobody in Tobago has got a grant. Turns out that almost 4,000 people in Tobago had got grants. I am sure that there are people who expect grants who are not getting it and not getting it fast enough. That I'm sure about. But what I'm also sure about is that the people who are getting grants are not saying anything. Right? Because in Tobago, a population of 65,000, the numbers were called out on that station, and I can tell you that Minister Robinson Regis has a program scheduled for Channel 5 one day this week, where she will give you a full update. And I know that those grants are being serviced in Tobago, so any man who leaving to go to Trinidad to get his grant is somebody to watch. Right? Because Tobago is very integral in the process, and I must say though, I'm not trying to give the impression that the grant system has worked well as we would have wanted it, but the main reason why the grants have not been going out faster is because we have to screen people. There are persons, many persons, who are trying to access the grant when they don't qualify and accessing more than one or more than once. And therefore, if we are going to be responsible with public money, you have to determine that the person getting it is the person who qualified and the person who should get it. And that slows the process down. So every time a smart man or a smart woman comes into the system, what the effect of that is to slow down the grant, because we just couldn't hand a check to anybody who say, I want one. There's a system, and the system is slowed by having to screen people.
But Prime Minister, if I can add to what you have just said, based on the information we have received from the Ministry of Finance, 80% of Tobagonians who have applied have since received the grants. We are processing rental grants from the Division of Health, Wellness and Family Development as well. We had initially received 200 applications. Those were processed. We are paying the 3 months at the same time. We have since retrieved those applications from the Ministry of Social Development for rental grants in particular, and the verification is almost complete. We are verifying, we are doing random verification, and we are also verifying persons by phone as well. Most of those who would have applied for food vouchers, food support, within the division have received, because it's a relatively quick procedure. We have even looked for persons who were in reforestation program, and we have issued them with vouchers and that kind of thing. So quite a lot of persons have been receiving support, not only from the ministry, but from the Division of Health, Wellness and Family Development. And we would have put out information if there are any challenges. Come to the division. There is a Miss Susanna Davidson, if I can remember the name clearly. She has been dedicated to treating with any outstanding issues at all level.
Question to Dr. Rowley, Corey Connolly, Newsday. Dr. Rowley, given what you just outlined with the salary relief grants and the other social relief initiatives, did the government have any mechanism in place to gauge the success of these various initiatives?
Well, you must remember that social support, there is a Ministry of Social Support and Family Services, and there was an ongoing relief program for people who looked to that Ministry for support. What the COVID virus challenge did was to make a huge demand, and with immediacy. So the public service did not really have a structure, an infrastructure to move from hundreds to tens of thousands. But we did embark upon doing that, and we have done reasonably well in treating these tens of thousands of persons between February, March, and now. But there are still some areas in the system which I keep hearing about the rental grant. I think that is the one that is probably most open to abuse. That's why it is so slow. But in terms of the food relief, I think we did wonderfully well with the food relief. And for those who like to run down and badmouth this country, call your friends in the islands next door, the countries abroad, and ask them what their governments have done. Trinidad and Tobago is in the forefront of having provided food relief in the COVID period, having provided financial relief. So some people have a view of it that it is not good or not good enough, but by and large, what we have done is not to be sneezed at. The first thing we had to do was to get the financial resources available to back it up. Because what we're doing is giving people cash. We had to find the cash, and in many instances, the cash was not readily available, right? And there were lots of other demands on the Minister of Finance and on the government, and we've been meeting all these competing demands, maybe not as fully and completely as each one would like, but it's like juggling a number of balls, and we've been juggling all of them and keeping them in the air.
Question to the Chief Secretary. Has any decision been taken on the format for the Tobago Heritage Festival? I know it's going to be virtual, but has anything been firmed up as to how that will transpire?
Not at this time, but I believe by next week we should have some information in terms of what exactly we'll be doing with respect to the Tobago Heritage Festival. Right, the Festivals Commission is working on that at present.
And question to the Health Secretary. Has there been any update on the healthcare task force that was established under the former Chief Secretary? Can you provide any updates on that?
Right, that task force was under the Office of the Chief Secretary, and they are continuing their work at this time. Of course, the pandemic would have caused some serious delays to their work, but the work continues, and sometime in the near future, a report will be forthcoming.
Whitfield, he's left. Whitfield, you said you had some more questions? Oh.
Good evening, Lois Vincent, Guardian Media.
Okay. I did not recognize you as a member of the media coming from that part. Sorry about that.
That's quite all right. Dr. Rowley, can you say what is going to happen to the local students currently in Cuba? First question. Second question is, would any concessions be made for bar owners whose license would have expired during the lockdown period? Third question
Wait. Let's take them in doses. With respect to the bar owners, we did observe that it would have been possible that some licenses would have expired before this period of challenge was over, and the Attorney General had made arrangements in law for the licenses that have expired to be extended further. And I think that those licenses that are expiring during this period, there are no penalties because the life of that license would have been extended by law. So that is in place, and we had looked at the law to give that window already. So I don't know when the next extension would be required, but I seem to recall that was done. So if a license has expired about now, or just before now, the bar owner would be covered. But very soon, we will have to, the public service is open, so I guess we can begin to renew licenses. The other question was that? The Cuban students. We did make arrangements for students at the University of the West Indies on the basis that this was a quasi-government institution, and we had children in what were government departments. So very early in the proceedings, the government assumed the responsibility to bring our children home from the University of the West Indies. Now, I understand that there are some students, some of them are in Grenada at a university which is not government-owned, and another one, and they're still in Cuba. The students from Cuba have a slightly different difficulty in that they, on application for exemption, there's no air transport between us and Cuba. So even if you grant them the exemption now, question is how do they use it? And that is why they have not been put on the priority list, because there's no connection to bring them home. But we are looking at that, and at the first opportunity, I spoke to the Minister of National Security midnight or thereabouts, and this is the matter we discussed. What we're aiming to do now, having brought this large batch of people in, and they're in quarantine now, we are seeking to look around the region and try to bring in from the region persons who are in that situation once there is an opportunity for them to make the travel home.
When will the lights be turned on at the public recreation grounds? The lights be turned on at the public recreation grounds.
Me?
Well, you're in charge. No?
That's for him. As Prime Minister, I know nothing about lights on public recreation ground. That is local and very local. So maybe my colleague here can probably help us with that.
The question came from Trinidad, actually.
In Trinidad?
The question came from
The question came from Trinidad?
Yes.
To ask me about which recreation ground, the one in Glencoe? I'm the MP for Diego Martin West.
Well, maybe you can respond to that one. Maybe you can tell us about that one.
Well, that is the matter for the Diego Martin Regional Corporation, and I do not have that information at this point in time. But now that we are opening up for sport, I expect that the lights would be turned on in that context.
So, can I go ahead?
Yes, please.
So we're looking at post-COVID recovery.
Yes.
Are you concerned, what concerns you most about Tobago's recovery? One. And two, do you think, it's related to the first question, do you think you would need to inject more cash into Tobago?
It's not cash. It's a spirit. You know, in Trinidad, as we were called upon to treat with the COVID challenges, one of those challenges was to make sure people have food and that there was nobody in the lockdown at home starving. And the government moved with great alacrity to get food to people. And we introduced in the food support system not just the food card, where they can go to Hilo and buy imported stuff and so on. We introduced the distribution of fresh fruit, fresh food and vegetables, a box worth $250. and persons were given that box and a voucher that they can go to the grocery for $2.50. Those boxes of fresh food supplied by NAMDEFCO were among the better issues that the government dealt with. But you know what disappointed me here in Tobago? That you couldn't do that here. Because there was no food being produced in Tobago to put in any box for anybody here. And if we had to do it in Tobago, the food had to come from Trinidad. And that is what disappoints me. Tobagonians have to get back to producing food. And if COVID does nothing to Tobagonians and make us produce more food on this island, all's well that ends well.
Well, maybe you can liaise with Mr. Dennis, because he can tell you a little bit more about that. And last question.
When you meet the THA people in conferences like this, talk to them about Tobago producing food. When you meet Tobagonians, you meet Tobagonians in Tobago, waiting for cucumber from Trinidad, right? And carrots from Trinidad, and cassava from Trinidad, and plantain from Trinidad. When you all meet here like Tobagonians, you all discuss that. Tobago has some of the best soils in the country and is not producing any food. So when COVID comes, we are more exposed than anybody else in the country. So what we're working on in the post-COVID period, as you mentioned, is to fix that. And we are actively engaged in that. The Chief Secretary and I have been talking about that, and we've gone beyond talk. We got some plans and programs. And in fact, I don't want to tell tales out of school, but you will be seeing changes.
Final question for now. Sorry.
I think early on some action has already been taken. I think people across Tobago and Trinidad and Tobago is seeing really a new drive towards food production. I am on my feet as Chief Secretary. The Secretary of Agriculture is also working assiduously with this new energy and vibrance, ensuring that we get out there, meet the farmers, find out what their challenges are, and from the THA's end, ensuring that we adjust and put the necessary infrastructure and support mechanisms in place so that we can, in fact, produce more food. So the work is ongoing and it continues.
All right. Final question for now, Dr. Rowley. I know that we are now looking towards local tourism, domestic tourism. Will any consideration be given to maybe doing away with the Caribbean Airlines $50 change fee to encourage domestic tourism?
Well, you must remember why that change fee was put in place. It wasn't to encourage or to discourage tourism. It was to discourage abuse of the booking system. Because we have to understand that we just can't have an infinite number of seats because we have a limited number of planes. What was happening is that people, for their own personal convenience, were booking ad lib and at will, not using it, and causing other persons who wanted those seats to be either discouraged or disadvantaged. So that booking fee was in relation to how the booking system was used. If it can be said that the system is being used better and therefore there's no need for it, well, then that's the argument. If, on the other hand, the reason why it was put there is still there, then I can see it continuing. Was there another question? That was the only part of the question, right? Okay, good. Thanks.
Good afternoon, Prime Minister. Vernex, the VO 91.9. And I want to keep with Caribbean Airlines in particular. Some people have been asking about the opportunity for Caribbean Airlines to start to travel, to take people out of Trinidad who may have to go for various cases. Is there any intention to start economic activity for Caribbean Airlines on a regional or international scale?
Well, we are maintaining Caribbean Airlines at great expense to the taxpayer in readiness for its utilization at the earliest opportunity. So today I can't give you a direct answer to that except to say that Caribbean Airlines, looking at the outside world, would be operational at the first opportunity it gets, because it's costing us money now to keep Caribbean Airlines where it is, maintained and not working. The reason why it is not going outside is because of the level of risk involved or the unacceptable economics of just going in one direction with the planes.
All right, thank you.
And taking passengers in one direction. But you may very well see, that's one of the discussions I had with the minister late last night, early this morning, is as we moved, you may see the first action some Caribbean airlines doing quasi or semi-charters where we pool people together, get them out, pool people, bring them in using Caribbean Airlines. But the schedules and for bookings, you will probably wait for a little longer, but I know Caribbean Airlines is readying itself to provide that service as soon as it is safe and feasible.
All right, and Minister Dialsing, I know while Tobago is an excellent place for vacation, we can't allow you to...
I thought you all forgot me.
No, yeah. Just I wondered if either you or maybe Dr. Parashman, depending, could you speak to the geriatric homes and people visiting geriatric homes
Yes.
and taking care of the elderly in
Yeah.
this moving forward?
Yeah, so we instituted under the direction of Dr. Rohit Doon a very comprehensive program to manage those institutions, because when you look globally, in a couple of countries, the main source of fatalities is coming from old people's homes and long-stay homes. We work very closely with Ms. Carolyn Ruiz, who is the president of that group. We have supported them with policy. We have supported them with PPE, sanitizers, and today, to the best of my knowledge, and the CMO could confirm, we have had no adverse reports of anything from our long-stay homes, and that is to be celebrated. Absolutely celebrated, and we continue to work with them.
All right, and just this question to the...
Keep talking to the minister on the head table for a minute, please.
Sure, no problem. Secretary Davidson Celestine and probably Chief Secretary, I have gotten some questions from persons still about the ICU unit being present and being used to facilitate COVID patients or even being used, in the COVID response. And people have expressed concern that it is attached to the general hospital and it should be parallel. I don't know if we could speak to that to add some comfort on a national level or Tobago level as to what is happening with our making the parallel system separate and apart from Scarborough General Hospital.
Well, as I would have responded earlier, indicated earlier in my press briefing, I indicated that we are working to move any suspected patients up to our old hospital facility. We have identified one TREC, that is the Tobago Rehabilitation Center. We have identified the geriatric center, and you would have heard Dr. Mitchell indicated that, and then we have the option of the old Scarborough Hospital as well. Those facilities, most of them are ready as we speak, and so we expect that by June 29th, we would not have to deal with any suspected patients at the Scarborough General Hospital. So if someone comes up from this at this moment with any signs and symptoms, that person will be held for observation at the TREC facility, at the old, up at the fort rather, and we are working endlessly on getting the PCR machine up and running so that we can test and be able to treat with the person within the shortest possible time frame.
There's one area I didn't touch, and as you mentioned a while ago from the last speaker, the Guardian reporter, what we do with respect to the geriatric homes. I have been lobbied a fair bit by people who are saying that maybe we should allow family members to visit their relatives in these homes and to give some opening up in the homes. We've discussed this, and we've determined that because of the very high level of risk involved with persons in those homes, and because we have so far managed to keep the staff and the occupants away from the ravages of the virus, that we would want to maintain the protocols there for a while longer. And I can tell you that the CMO and his staff will be looking at that going forward. And if there's any opportunity to relax those protocols, that will come in the not too distant future. But we are not adjusting those protocols today. Yes.
Gail Thomas from Radio Tambourine. Forgive me if you spoke about this before, in case I missed it. Are hotels and guest houses open to receive guests?
Yeah. Yes, they are open. As a matter of fact, yeah.
Even in the early stages, they would have been open. But of course, the in-house dining was not part of it. The restaurants weren't part of it. So they were open in terms of the regulations from quite a while ago.
I think from the very beginning, what we had done, we restricted the nature of the operation. And then sometime later on, I think it was phase 3, we said resident guests could be fed on the outside in the open air. And I gathered that was going on. And I spoke to the manager of the Magdalena this morning, and he was smiling. He reported a 30% occupancy and was smiling. That's a long way from 5%. People are occupying the Magdalena again, and they're being promoted, so hotels are open. It was the condition of opening that had brought the closure in many instances. So we are having the hotels open. And today I announced basically back to the normal arrangements.
Okay, Minister of Health. In terms of I wasn't too clear on the caregivers. Can caregivers, those persons who go out to work at homes, that's homes in the communities, elderly persons, can they go back out to work?
Well, there was never a ban on them going to work. What we asked the owners and operators of the homes to do was to make sure they were properly sanitized, that they had masks, and most importantly, to do temperature checks for fevers and so on, to make sure that if anybody had a fever, a sore throat, did not get inside the facility. So there was never an outright ban on caregivers.
Right. In terms of, this is a question from somebody from Trinidad.
Sure.
In terms of shift workers, now that restaurants and so on are going to be, and casinos and so on are going to be open until 10 p.m., the workers are concerned as to how they will get home, as they say the maxi taxis and so on do not work late due to persons have to wear masks now, and so they are the taxis don't work late because of that. So they're wondering how they're going to get home.
A good question, but I'll tell you what. We expect that people will find their way home, because I know that there's some people saying that they're scared of approaching someone with a mask in the night. But given the level of mask usage in the country, they will find their way home. And because if there's business there, the taxi drivers will take advantage of it. What we are, on the other hand, will be doing is ensuring that public safety and security remains paramount, admission of national security, and that the public transport is available.
So basically what will happen is that the demand for transport will drive the supply. Okay?
In terms of meetings, like credit unions and other organizations, annual general meetings and things like that, can they go back to holding those meetings with less persons?
Well, meetings, we encourage you to be virtual as humanly possible, but if you have to have internal meetings, public health guidelines again apply. Sanitation, clean your hands, mask, distancing.
Just to go back on one of the issues that Gail raised with respect to transport, is it that public transport, maxi taxis, buses and so forth, that remains at 75%?
No. I did say that public transport will go back to normal service.
Okay.
Right?
Okay.
So whatever restriction there was on those, the last time we spoke, they were at 75%. We did say, remember, it was 50%, then 75%, until he was lifting it completely. So they will operate at will.
But Prime Minister, if I may, that's a good question, because we discussed this yesterday. With public transport, what we are asking again, unless rain is falling, of course, keep your windows open, so you get the fresh air coming in, you get that ventilation. And as far as humanly possible, wipe down all your hard surfaces after each trip or every hour, whatever, to minimize spread from hard surfaces onto your hands. So public transport, whether it's a small taxi, four-seater, 12-seater, 25-seater, plane, ferry, public health guidelines apply, but you can't turn on the windows in the plane. But in the maxi taxi, wherever, keep your windows open, sanitize, and wear masks, okay?
Before I get to my last set of final questions, there is... Yeah, you go.
You have 2 more questions. It's 4 o'clock, right? So the press conference is about to end. So that last set of questions that you have there, pick the 2 best ones.
Okay, what we are seeing as an emerging trend now, I don't know if it's happening in Trinidad, but here in Tobago, we are seeing persons having their sinks outside, they have running water, they have paper towels, but they're watering down the soap.
They're doing what?
Watering down the soap. So they're putting water in the soap bottles to stretch the soap, and it's becoming more and more prevalent. So I don't know if you want to...
I feel that is not a real complaint. I don't think that is widespread.
Well, within the last few days,
if 1 or 2 people do that, they might have a good reason for doing it. But as long as the soap remains effective, water in soap doesn't make the soap less effective. Only you might need some more soap. Okay. But tell the people who do that they might be using more soap by doing that.
Okay. With respect to the CARICOM issue, in a couple of weeks there is a scheduled meeting of CARICOM heads.
Really?
In early July, that's when there's usually...
Or the intersessional, yeah.
Yeah, the intersessional.
Yeah.
Right. So
you're ahead of me on that. We're supposed to have meeting in St. Vincent, huh?
Right.
Yeah.
Well, is it that would take place as planned, or there are going to be some changes to the format and so forth?
I don't have an answer for you for that at the moment, because as I was coming here to Tobago, I saw a document come in, a saving gram, but I did not read the whole volume. If it's not in there, I can say I don't know just yet. But up until when I came here on Friday, that decision was not known. So I don't know if the meeting would be in person or virtual in St. Vincent, because the Prime Minister of Barbados is giving way to the Prime Minister of St. Vincent, who will become the next head of CARICOM.
Okay, all right, so I'm back again. I would not be long, but I'm back. This question is for Minister D'Alsing, sorry. In terms of psychiatric nursing students, they are wondering how soon will they be employed. They said that a number of them are home, but they are not being called to work.
Students?
Some have been called, yes, students.
I wouldn't have an answer for you off the top of my head, and I prefer not to make up one.
Okay.
But it's something I will look into.
All right.
Okay.
This question is for Dr. Rowley. Mr. Azad, Jeffrey Azad, he's a businessman, a Tobago businessman, and he is still in the United States hoping to come home. And I know that the borders remain closed, but he also asked for an exemption through the National Security Minister, but he said he's not getting an answer. He is willing to charter a flight with a number of other people to come to Tobago. I don't know what you can tell him.
I can't tell him anything. That I'm not prepared to discuss individual requests in that way. What I do know is that the Minister of National Security has dealt with this matter and has granted Mr. Azar an exemption. And I would rather not say more about it at this time.
No problem. What about community pools? Some are asking, can the YMCA in Tobago, can community pools reopen?
Doc, you want to answer that? Because as far as I'm aware, we didn't specifically prevent them from but I think the doctors can give you an answer to that.
So sporting activities to some extent, and we had gone ahead and said, okay, for sports. Of course, we have to use the guidelines. Specifically in the changing rooms, it's very important to have the smallest number of people in the changing rooms at any one given point of time. That's the most critical area where we have people congregating. In the wider areas, of course, avoid close contact even while you're within the pool setting.
Okay.
You guys remember, swimming pools are heavily chlorinated, so the water itself is not a problem. So it is the usage and it comes back to congregation and the personal hygiene and the personal contact.
Okay. My final question, this one is for the Health Secretary. I know there was an incident involving a Venezuelan national in Roxborough at the Roxborough Hospital site, and he was later hospitalized after falling some 20 to 34 feet from a scaffolding. Have you looked into the matter in terms of investigating it to know if any OSH requirements or OSH guidelines were adhered to, and has an investigation been launched?
No.
I think I should, as minister responsible, I should take that. That's my portfolio. Yeah. It's not a Ministry of Health. The hospital that's being built in Roxborough is not yet with the Ministry of Health. It is being built for the THA by UDCOT. And I think as minister responsible for UDCOT, as Minister of Planning and Development, because I'm sure you didn't know that, I hold a portfolio of planning and development and UDCOT. So that would be an issue for UDCOT. And if there's an accident on site, the normal protocols will apply. I have not heard of what you just mentioned, but I have every reason to believe that the normal protocols would have applied.
Thank you.
Hi, thank you. Vern again, 91.9. Quickly, just to get some clarification.
Before you go, we have 5 minutes more. And
yeah, just one quick one.
That would have been a full 2 hours. Have we had the full 2 hours yet?
No, not yet.
Because we plan to have...
You still have 30 minutes for 2 hours.
How much?
30 minutes for 2 hours. If we head into 2 hours, 30 more minutes.
Yeah, okay, take your 5 minutes.
Thank you. All right, so just quickly, just clarification on the beaches, especially in Tobago, activities at beaches, kayaking, reef boat operations, etc.
All back to normal. All back to normal. But those who are doing it, remember your personal responsibilities. And if it's a group activity, the group should not be larger than 25.
And I just want to add as well that the Division of Tourism is also releasing very soon specific protocols for that sector in terms of the roof boats, how they're going to operate, jet ski operators, all those persons in terms of how they operate within the specific guidelines. And of course, those protocols will be guided by the overall health guidelines.
Dr. Rowley, the THA budget is Monday. I'm wondering whether the central government and the THA are in discussions on any post-COVID recovery initiative outside of agriculture.
Yes, answer is yes. The THA and the central government, we are constantly in discussions at all levels. Prime Minister to Chief Secretary, secretaries to ministers, and the post-COVID activities. Tobago is central, and we are in fact preparing for Trinidad and Tobago.
Just one more, Dr. Rowley.
That's the last one, right?
Any announcement on the election?
Yeah. I want to make the announcement now. There will be an election. Thank you all very much for coming, and thank you all from Tobago. You've been with us throughout, and thank you for the job you've done. And I want to, from the Ann Mitchell Gift Auditorium here in Tobago, to extend my personal thanks to the healthcare givers who took us through this and are taking us through this. And on behalf of my colleagues in the Tobago House of Assembly, I want to extend a particular welcome and thanks to Dr. Roshan Parasam, who's with us today, and his staff, who have made this country proud, and we expect that they will continue so to do. Thank you very much for what you've done and what you're doing, and please extend from Tobago the welcome from Tobagoans for all health staff in Trinidad. Tobago is open for business. Thank you all very much.